So, good morning, everyone. This marks 39 weeks today since our first case of COVID-19, 273 days later. But unfortunately, sadly, I have to announce that 2 more Albany County residents passed away to the coronavirus last night. A man in his 70s and a woman in her 90s. This brings our death toll to 172 since the outbreak started. To the 2 new families, my condolences and prayers go to you. To the other 170 families, again, I know it's a difficult time to be dealing with this health crisis and to dealing with losing a loved one. So again, our thoughts and prayers are with you. It's difficult enough to lose a loved one in normal circumstances. Yesterday, it was also said, for the United States, it marked the first time we lost more than 3,000 Americans in a single day. I know during these briefings we provided a lot of large numbers, and it's easy to lose it in translation. But it comes out to be roughly 2 Americans lost every single minute to COVID-19. These are real people with families, not just a statistic. And I want to remind that. I know there's the people that have their opinions, and I know everyone has their theory on all this, and the people that think they're health experts. So I thought, who better to bring in to a health expert to talk about it? But as of today, we have 7,304 positive cases of COVID-19 in Albany County to date. 2,413 people are currently mandatory. That's an increase of 208 positive cases overnight. This is just the second time we've had more than 200 cases in one day. Of the positive cases, we know 21 have close contact to positive cases, 14 are healthcare workers, and 173 don't have a clear source of infection at this time. Over the last 5 days, there's been an average of 170 new positive cases each day. Yesterday was 163.8. As of today, 27,136 people now have completed quarantine, 5,904 tested positive for the virus and have recovered, 118 new recoveries since yesterday. So this is good news. There are now 98 people currently hospitalized from the virus. Yesterday it was 94. This is the highest number of people we've had in the hospital because on the onset of the virus at one time. The previous record was 96. Again, records that I'm not happy that we continue to break. And then 96 was set on December 4th. 14 patients currently in the ICU, down from 19 yesterday. Another good reason to have Dr. Venditti with us today to talk about this. So to be clear, we're still not clear on how the micro cluster zones at this point are going to be working. But one of the things the governor keeps pinpointing here in the Capital District, it's going to be based on ICU beds, hospitalizations, nursing staff, doctors, hospitals. So again, who better to have here to discuss all that and let us know where we stand. So as we continue to move forward and, we're not trying to downplay it. We got the highest amount of people coming back. We've talked about this. This is 2 weeks since Thanksgiving. So we're at that peak where we thought we would be, and Dr. Whalen said it perfectly a couple days ago that we would be well over 200, and here we are. So as we look at the state regional dashboard and the capital region's measures of the severity is low compared to most other regions, which is good. If you look around, even though our numbers and percentages are high, they're not as high as out west. And I was on a Zoom call yesterday with Mark Pullencarts out in Erie County and talking to Steve Newhouse from Orange County and Ed Day from Rockland. It's, these zones are popping up in much more capacities of red zones and other areas that they're in. So we compare our region to other hospitals. So the measurement of new hospitalizations per 100,000 people, if you look at the board, we're at 2.5 compared to the state's average of 3.21. That's the only region lower than the North Country. When you look at hospital capacity, we have 26% of our hospital beds available, 40% of our ICUs available in the region, and they were both above the state's average of 22% and 36% respectively. The region data is important because most hospitals here in Albany County, and we have regional hospitals here like Albany Med, that goes into consideration to what Governor Cuomo and his team are looking at. So I would like to turn it over to Dr. Venditti at this time to really talk about the data, the hospitals, the ICU beds, and where he thinks we are as a region going forward.
Thank you, Dan. Thank you for inviting me. I'm happy to be here and talk a little bit about what we're seeing, what I would call from the ground level, both at the medical center, and actually I can speak a little bit about regionally what's going on. So let me start with the medical center. Today we have 63 patients in the hospital with COVID. Those 63 patients are primarily in our med-surg beds, so not in intensive care. 13 of them are in intensive care, and only 2 of them are on a ventilator. That's very different than what we saw back in the spring. Back in the spring, those numbers would have been about double, about twice as many patients in the ICU, and half of those patients in the ICU would have been on ventilators. And you know, we're trying to sort out why that is. It's probably a combination of factors. The demographics of our patients are a little bit different. More of them are coming from the community as opposed to nursing homes and other congregate facilities. The age distribution is a little broader, although we have a 17-year-old in the hospital and a 96-year-old in the hospital, so a very broad age distribution. We've learned a lot about how to care for patients with COVID. So when they come in, when we first diagnose them, we give them a cocktail of treatments right out of the gates, remdesivir, convalescent plasma, and dexamethasone, which has been very, very helpful, particularly in the intensive care unit, those kinds of patients. So there's that aspect, both the patient themselves as well as our treatment strategies. We use high flow oxygen as opposed to ventilation, and we think that makes a difference as well. And there's been speculation that perhaps the virus has changed. I don't know of any data specifically about that, so I can't really comment on that. Our experience is replicated in the region. So since March, we have been coordinating with the 12 hospitals in our region through, in the beginning, a daily call where we shared what was going on in our institutions, providing each other resources when necessary, doing testing for each other, accepting transfers from each other, sharing medical approaches to these patients. And we've continued to do that. So twice a week now, we get on the phone and we share all that information. So Tuesday was our last call. And what I can tell you is on Tuesday, there were about 300 patients in the region in hospital. And let me describe the region. It's not just the Capital District. It's the region that we consider our catchment area for healthcare. So it includes all the hospitals in the Capital Region, but also includes St. Mary's in Amsterdam, Nathan Littauer in Glens Falls, Adirondack Medical Center in Saranac Lake, and Bassett down in Cooperstown. So 301 patients in hospital on Tuesday. 43 of them were in intensive care, and only 23 of them were ventilated. And again, those numbers back in March and April would have been double. So not only are we seeing a shift to less intensity in our hospital, but that's being replicated across the region. And I think even the state data suggests that that's happening. So we, in addition to sharing information about what's going on in our institutions, we are attempting to coordinate. We're actually trying to work like a healthcare system. Again, we talk about the kinds of care, how to provide care. We've coordinated around visitation as the incidence has gone up in the community. And we've talked about, to some extent, and we're going to talk more about this tomorrow, how we might load balance within our region should we get to a circumstance where that becomes necessary. So I guess I would say we are very confident as a group of hospitals that We have this currently under control. We see a path for caring for more patients with COVID as if and when that becomes necessary, and unfortunately I think that will become necessary. We are not at capacity, particularly in the intensive care area. We have capacity for more patients simply because of the distribution of how those patients are falling ill.
Thank you, Dr. Venditti. But, it goes to question, as we look at this micro cluster zone that we could be in at this point and should be in, and what the governor's basing on, this changes, and it changes the way you address with it, and what we were dealing with 9 months ago is differently now. Not trying to downplay it, I will tell you, I am worried. 208 new cases overnight, 2 people passing away. But I also want to let people know who better to talk about the crisis that we're having is, are the hospitals okay in this area? And the answer is yes. But one of the things I do want to talk to you about is we've been talking about how this vaccine rolls out. And we just had this question because I was talking to my nursing home director, and I got to say, Sheriff Apple had a great plan of how we get the vaccine out. The health department under the medical corps, we've been practicing this for 10 years. But again, at the end of the day, it's not up to us. It's up to the federal government and the state. And you can get into this better than I can, talking about how the vaccine is, the first phase in mid-January is going to be going to Walgreens and then to the nursing home. But I'll let you take it from there. So we're just discussing this on the way down.
So we started back in September a small work group at the medical center to think about all the issues that would be involved for us and perhaps for the community ultimately with the vaccine. All kinds of things. Consent, how we would administer it, physically, where would we do that, how would we track, because all the vaccines that are coming soon are 2 shots, and we need to be able to track people and alert them when their second shot is due. How we would feed information to the state, because the state's going to want to know what's going on, et cetera. So we've had a work group literally for several months working out all those logistical issues for the medical center. The 2 vaccines that are likely to become available soonest, and we'll probably find out today, the Pfizer vaccine and the Moderna vaccine are a little bit different. I won't go too much into how they work from a biology perspective, but they are a little bit novel. They require a little bit different handling. The Pfizer vaccine needs to be stored at ultra-cold temperatures, not the kinds of freezers that most hospitals have. We at the medical center, because we're an academic institution, just so happen to have an ultra-cold freezer. The Moderna vaccine is a little bit more tolerant. It will last 30 days in a refrigerator and 6 months in a standard freezer. The Moderna vaccine, the data has not yet been produced for the public. Yesterday, the FDA did produce for the public, on Tuesday, produced for the public their analysis of the Pfizer vaccine, and that's going in front of the FDA panel today. So my expectation is that they're going to approve that vaccine, and we will hear shortly about how it's going to be distributed nationally as well as locally.
Thank you. And I know you're probably going to get a lot of questions from the press, but when we make these decisions between Dr. Whalen and the health department and my office, and we decide which direction we've been going into, who better to lean on than Dr. Venditti in an institution like Albany Med, because again, they are not just a hospital, you are a college and you're a teaching university, and you're the biggest hospital we have in the region. So thank you to you and your team there, and continue to work with us as we move forward, because like I said, it is a health crisis. We have to deal with it, but it changes and it evolves, and I am still worried about our numbers going up the way they are and people passing away and the hospitalizations going up. So it was a nice lifeline to reach out, and I can smile now. I wasn't smiling because, again, I was worried. I'm like, are we going to be able to handle this? Are we going to see a surge of patients? Again, not being a doctor, who better to talk to say, no, it's okay, it's a serious situation, but we have new tools and resources to address it. These are my words, not yours, but that's the way I was hearing it, of saying, okay, because you have that $1 million question: do you shut down? Do you not shut down? Do you advise going into these zones? But I'll let you go from there because.
So let me be clear. We are prepared to provide the care the community needs. That doesn't mean we're not worried about what's happening. The numbers are troubling. And I think that everyone in this community has a role to play in combating this pandemic. For us at the medical center, it's a high level, it's healthcare, it's vaccine administration perhaps. It's a whole bunch of things that are very detailed and somewhat complex. But everyone sitting here, all of the press sitting here and everyone listening to this in our community, you have a role to play too. Probably the biggest role is this mask. Everybody's tired of wearing masks. I'm tired of wearing a mask. I still wear the mask. And I would say all of you should still wear your mask. Not only should you wear it, you should wear it correctly. It means covering your nose and your mouth. Growing up as a kid, I can still hear my mother's voice telling me, go wash your hands. It's usually before Sunday dinner, but go wash your hands, Fred. And I would say that's another thing that everybody in the community can contribute to fighting this pandemic, which is that hygiene, that hand hygiene. And then, of course, the third thing that we talk about is social distancing. And I'm happy to see everybody in the room has their mask on and is socially distanced, more than 6 feet apart. It seems like such a simple thing, but it really is important. And as I said, everyone in this community can contribute to fighting the pandemic by doing that. Those 3 simple things.
Thank you. And I'll just get through this because I know there's probably going to be a ton of questions for you, Doctor. But I just want to highlight a couple things. A card sent when I challenge everyone to have your school-age kids, or anyone, even adults, want to take the time and send an e-card to our residents at Shaker Place or any nursing home or anyone in the hospital to take the time to brighten up their day. We encourage that. And someone did take us up on that. And I just want to say what part of the card says: during the times like this, we learn how much our friends and relatives really mean to us, which was so nice and touching. So, I'll say to everyone, please, it puts a reality check on everything that we're going through. And as much as you think that you're dealing with, think of someone that hasn't had the opportunity to hug a loved one, but is doing the right thing. And we are doing the right thing, protecting our most vulnerable residents, our nursing home residents, and protecting them from this virus. So please take the time, send a card, and it really goes a long way. Also want to remind, Hanukkah's starting tonight, and with Christmas and Kwanzaa right around the corner, we're asking people again for your help to send these e-cards and brighten up not just the residents that call that their home, our nursing homes, or even our hospitals, the people that work there, because they become like family to these residents. And and they've been under a lot of stress, the doctors and nurses, the LPNs, the people that any administrators, janitors, maintenance people in hospitals. It's been a stressful time for them. So just even to take the time to send them a card would be gratefully appreciated, and a big thank you. So you can go to Albany County Kids Care Albany County Kids Care at albanycounty.gov. Like I said, please just take the 2 minutes to send it. It's going to make a difference. We also want to remind residents about the Albany Times Union Center. The Watervliet Dome was a huge success yesterday. Went and met Mayor Petrocelli there, and it was really good for the residents there. So we'll be doing more times there because there's a need in the community. Like I said, I've been working with my deputy Dan Lynch and a variety of people in my office and the health department to roll out more testing. We know we have to get aggressive with the testing and provide more and make it more convenient for people, and obviously address the issue if they don't have insurance to pay for it, because the last thing I want to hear is someone's more worried about making a co-payment or paying for it over their health, because your health's more important to us. So we want to make sure we address that. Whitney Young, as always, 518-465-4771. If you go there and don't have insurance, we pay for it. Albany, as always, has been, they don't ask for insurance. So that number is 1-888-364-3065. And again, with Price Chopper, Purdy One, CVS, and I could go on, there's a variety of places. Go on our website, and you can get the wait time, especially if you want to get your children checked. Not everyone does children. Good question. If you got for the doctor, a variety of different places. Don't do kids at a certain age. Just handle adults. So please make sure you get that right. And again, our mental health support line, not just for adults, for children. We will address children's issues, parents, guardians, loved ones. Take that kid for a walk, talk to them. They're struggling. These kids are struggling, and they're having depression issues, and they can't go out and be kids. They can't go out and play, and they can't. It's great you're playing Xbox, whatever, or PS5, I think it is now, right? Kid said something to me. I go, "Where are you going to a concert or getting tickets?" He's like, "No, it's a game." I felt like, okay, I'm a little old now. But again, these are the things that these kids are doing, but that's not healthy either. So you have to talk to them. And that number's available at 518-269-6634. Our 24-hour sexual assault hotline is available, 518-447-7716. And again, New York State hotline is available. And, please take advantage of that. I just want to say this too. At the beginning of the press conference, we talked about 2 Americans dying every minute of the day. So just during this time since we started, we may have lost 60 lives in the county or ours in the country. This is truly a sad day, and we need to turn it around and make sure we continue to educate people to wear their masks, cough into their arms, clean their hands, and stay 6 feet apart. Vaccines there. It's going to take time to get out. Stay safe and healthy,